Now for Ask the Expert. The FDA has issued its strongest caution about a surgical tool that could spread hidden cancer.
The device is used by gynecologists in minimal invasive procedures to remove growths known as fibroids. Joining us live this afternoon to tackle this topic is Dr. Brian Baer.
Good afternoon.
This is a tough one.
Yeah, so this device is called the power morcellator.
The power morcellator.
People are going, what is that? How is it used?
It's a device that's inserted through our small ports that we do laparoscopy in, and it's used to take tissue out in pieces that we can't get out otherwise because it's too big.
So it saves you from having a major procedure, like an open surgery.
Absolutely.
Well, what are some of the issues that could cause us to use this procedure?
Well, the problem is that we've now determined that there's about a 1 in 350 chance that you could have an underlying sarcoma if you're perimenopausal or postmenopausal.
So hidden cancer, essentially.
Exactly.
Okay.
And so what's happened is this tissue can be spread throughout the abdominal pelvic cavity, and it can cause you to have an increased risk for the spread of cancer if it is a sarcoma. And this was found by a female physician who had this procedure out in Boston and was later found to have an advanced sarcoma that had spread throughout her abdomen and pelvis.
And she kind of spearheaded this. I mean, this is why it made headlines and is now out there.
Absolutely. Her and her husband are asking for a complete ban of this instrument, which a lot of people are not happy about because it definitely has a role in our practice.
Yeah, and the FDA has not banned it yet. This tool, though, has simplified these surgeries. So now, if you need this common procedure, what should you do?
Well, first, as I always say, find the most experienced surgeon, number one, first and foremost. But secondly, be willing to talk to them about the specifics of how they're going to do the procedure. As we've said, necessity is the mother of all invention. The new techniques involve putting the tissue in a bag so it doesn't spread as you cut it so you can remove it. And, you know, I think I would not be afraid to say to my doctor, if you're going to do the procedure this way, please don't spread any of this tissue in my pelvic cavity. And lastly, and most importantly, you always have to be willing to say, I'm willing to have this procedure done open in order to protect myself.
Wow. So you do think that this tool will continue to be used? You'll just find better ways to use it that are not risky?
I think so, and I think that's the cool part of all this. It's sad for her that she has an advanced sarcoma, but it's stimulating us to modify the techniques, and I think in some way or capacity it will always be used.
Is it fair to say this is a revolutionary tool?
Well, when it first came out, absolutely. It's saved a lot of women from having open procedures, but now we have to rethink how we're using it.
And in using the power morcellator, younger women are less at risk.
Correct. It's mostly the perimenopause and postmenopausal women that are at increased risk for these type of cancers. Nobody's immune, but younger people are a lot less at risk.
All right. Dr. Baer, thank you. If you have a question for our experts, you can email them at asktheexpert@today'stmj4.com. You can also leave a voicemail at this number, 967-5253.